Hey there. So when you think about anesthesia, what comes to mind? Probably just lights out, right? A switch gets flipped, you go to sleep for surgery, and you wake up when it's all over. But what if there's more to it? What if that time you're under is actually an incredible opportunity for your mind to heal?
I mean, really think about this question for a second, because it kind of flips everything we assume about surgery on its head. We see it as this purely physical event, something that's done to our bodies. And let's be honest, it can be pretty traumatic in itself. But what if that very experience, the one that so many of us are afraid of, could be a moment for deep psychological healing?
Okay, so for forever, the old view was super simple. You get anesthesia, your brain shuts down. It's basically off, kind of like a computer in sleep mode. But now, some really groundbreaking research coming out of places like Stanford University is just blowing that idea out of the water. The new view? The brain isn't off at all. It's actually in this unique state where it can actively process, rewire, and maybe even heal some of its deepest wounds.
And look, this isn't just some abstract theory. The proof is in these powerful, real-life stories. We're talking about actual patients who went in for a standard surgery and came out the other side with their lives completely and unexpectedly changed for the better.
So let's meet our first patient. This is a 57-year-old woman. On the outside, she was physically healthy, but on the inside, she was carrying this immense, heavy weight of severe PTSD after her son tragically died by suicide. She was going in for a routine breast lumpectomy, probably just focused on getting through it.
The research paper puts it so bluntly, it's just, wow. It says, her experience during surgery saved her life. So what happened? Well, while she was under, she had these two incredibly euphoric dreams. In one, she got to relive her son's birth, but this time it was just pure joy. In another, she spent time with him as a grown man, and it was deeply cathartic. This wasn't just a nice dream, it was life-altering.
And the results? They were just staggering. We're talking just 1 month later, and clinically she no longer met the criteria for PTSD. Her depression and her anxiety were significantly better, and get this, she went more than 18 months without a single nightmare. That's not just an improvement, that's a transformation.
And it's not a one-off thing. Check out this second story. A 72-year-old woman who had been suffering for years with PTSD and nightmares after her son died from alcohol poisoning during a fraternity hazing. Her trauma was old, deep, and really dug in.
And you guessed it, the same incredible thing happened. She had what she described as a very positive dream while under anesthesia, where she was with her son and her family, and the result? Exactly the same. After the surgery, her PTSD symptoms were gone, her anxiety and depression got better, and the nightmares just stopped.
Okay, so two unbelievable stories, same mind-blowing result. You have to be asking, what is going on here? What is happening inside the brain, neurologically, that makes this kind of profound healing even possible?
All right, let's geek out for a second and dive into the science. Researchers think there are a couple of key things happening here that completely change how our brain deals with traumatic memories.
The first big one is called memory consolidation. Think of a traumatic memory like a file saved in the wrong place on your computer. Every time you click on it, it's corrupted and it crashes the whole system. That's your fight or flight response. Well, consolidation is the process of safely moving that file to the right folder. It's still a sad memory, but it doesn't cause that system-wide panic anymore.
Then you have this second process, fear extinction. This one is even cooler. It's not just refiling the memory. It's like deleting the fear virus attached to it. The analogy they use is perfect. Imagine you've been terrified of spiders your whole life. Then you have a safe, positive experience with one, and suddenly that deep-seated fear is just gone. The memory of spiders is still there, but the terror isn't.
And this is where the specific anesthetic comes in. We're talking about newer drugs, with ketamine being the most famous example. They seem to put the brain into this state of heightened neuroplasticity, making it super flexible and open to change. It's like they open a window of opportunity for the brain to do this deep, therapeutic rewiring.
Now, this all sounds like a miracle cure, right? So why isn't every single person who has trauma and goes through surgery coming out healed? Well, that is the million-dollar question. And it turns out the conditions, the environment, have to be just right.
It really boils down to this. What's your state of mind before you go under? An environment that promotes healing is one where you feel safe. You're comfortable, maybe you have a warm blanket, you feel like the doctors and nurses are actually listening to you. That sense of safety creates the perfect setup.
But now, flip that. Picture the typical surgery experience for so many. You're already scared out of your mind. You're shivering because the room is freezing. You haven't eaten in hours. You're exposed in one of those flimsy gowns. Your brain is already screaming danger. In that state of fear, the door for potential healing gets slammed shut and locked. In fact, it's even more serious than that. A study done with rats showed that if the environment is stressful, giving anesthesia after a trauma can actually make the traumatic memory worse. It can reinforce it and lock it in even deeper. So this isn't just about missing a chance for something good, it's about actively avoiding something harmful.
So where does all this leave us? What's the big takeaway here? It's that we have to start thinking differently about these altered states of consciousness, whether we're talking about surgery, specific therapies, or even just our nightly sleep.
And here is the absolute most important point to get. Anesthesia is not a magic wand. Neither is ketamine therapy or meditation or dreaming. This isn't a new idea, it's exactly what researchers in psychedelic therapy are finding too. These things aren't miracle cures. They are incredibly powerful tools that can open a window to our own healing potential.
But a tool is only as good as the person using it, right? What this research is really screaming at us is that your mindset and your environment, what's often called set and setting, are the keys. Preparing yourself, making sure you feel safe, that's how you unlock the door. So, I really want to leave you with this final thought. This all suggests that you have way more power, way more agency over your own health than you've probably ever been told. The power isn't just in the drug or the procedure, it's in how we prepare ourselves for it. So the real question is, now that you know this, how are you going to use that power?